today from the Center for Pain Treatment on the South Side. He uses a technique that combines stretching exercises and pressure to get rid of really just about any kind of pain you can imagine. And I want to get right to him because you've gotten so much good response from people who have seen you and used your techniques and have been relieved from pain that they've had to deal with for years.
Well, thank you for calling me back, and
yes.
I'd like to share some things with the audience that maybe people have in common.
Talk about some, well, you started an exercise class, right?
Yeah,
so you teach people.
22 years ago, my son and I started an exercise class that teaches 100 different exercises for 100 different problems. So not everyone has all those problems. So if a person has behind the eyeball headache or has a temple headache, there's different exercises for those two things.
Show us some of the things that you do.
Well, I'm a pain specialist, and what I do is mainstream medicine. It was innovated by mostly medical physicians, and my biggest teacher was President Kennedy's doctor, Dr. Janet Travell. And the most common pain that I see among people is they have a pain up here on their shoulders, on the top of their shoulders. They feel very heavy, and they just can't seem to turn their head, and they're very, very heavy up here.
I have that. People talk about it in terms of that's where I carry my stress.
Right. And this is the most massaged area in the body in the world. You go through the parks, the boyfriends are massaging their girlfriends. You go through the movies, the wives are massaging their husband. And after they finish massaging, nothing happens because it goes back because it's not coming from there. This is like the leak in the ceiling, and the hole in the roof is really back there. And I'd like to share that with the audience, if we
Great.
could.
Yeah, please do.
Okay.
That affects
All right.
a lot of people.
Why don't you feel how tight you are up here? So everybody in the audience, I want everybody to sort of grab yourself up here and try to remember with your hand what it's going to be like maybe a couple minutes from now.
Okay.
Okay, now I'm going to show you 3 exercises to do that. I could treat you by doing the pressure on the trigger points back there, but I'm just going to do the stretch part of the therapy so we can involve the listening audience.
Okay.
So we take our hands and we put our elbows together.
Okay.
And it's important to keep your elbows together, and we push up towards the ceiling, and then swing your hands around like this.
Okay.
And then rest it a little bit. Okay, let's do another one. Now the trapezius muscle, that's what we're stretching, has 3 different kinds of fibers running in 3 different directions. So 3 men have robbed the bank, and they run out in 3 different directions. Well, we need 3 policemen because they're 3 different directions. So here's the second direction. We grip ourselves like this, we lean down, and we're trying to force that stretch right here between your shoulder blades. So you just stretch to the right, stretch to the left.
While you pull on your shoulder.
That's right.
Okay.
But you want to feel the stretch in the middle of your back. So everyone who's doing this with us, this is how to alleviate that big tight pain on top of your shoulders. And then keep your arms crossed, hold onto your thighs, and lean from side to side. And you're trying to feel that stretch.
Did you hear that?
Yeah, that popping noise is a muscle.
I'm popping over.
It's a muscle slipping on top of another muscle. Here's what's happening. The muscle's so tight, it slips past another muscle, and it goes like that. And after you do these for a while, you gradually lose that popping. The snapping crackles go away. Okay, now let's go back to the first one. And 3 exercises for 3 different direction fibers of the trapezius muscle. Now, I've learned this from medical doctors, and the books that I use, my medical Bibles, are in every single hospital in Pittsburgh here. Now, feel that up there now. What happened?
It is looser. It is.
But we didn't touch this. So you learned that this leak in the ceiling is coming from this hole in the roof. So we are working on holes.
Yeah, because these the exercises I could feel more in the center of my back even than anything at all, even feeling anything stretching up here.
That's right. So
Interesting.
Now, if you can then get satellite effects, if this causes it to get tight, and it gets tight for more than a year or maybe half a year, then this has a predictable pain pattern of having a headache right there.
What about sinus? You're talking about sinus is so common, and we just, did this study about antibiotics may not be the best thing for women.
You shouldn't be taking them extra. Save them for the big stuff. There is a muscle in the throat here called the sternocleidomastoid muscle. It's right here. And this muscle, when it gets too short, too tight, and muscles are like rubber bands. When they get too short, then they're not strong. If they're very short, then they start becoming so weak they're causing problems that go elsewhere. So this muscle can send a headache around the eye like a sinus headache, but it also can fill up the sinuses. So here's a stretch for that. We turn our head to the side and bring your chin down and hold it for 3 seconds.
Okay.
All right, got it? And then turn it the other way, to the side, and hold it for 3 seconds. Let's do another one. Really, you should be doing about 3 of these, but we're a little pressed for time here, and this will still work anyway. Now, that sends problems to the face, where the sinuses are. And now we're going to work on a muscle that's very close to the sinuses called the zygomatic. What a great name.
The zygomatic muscle, I love it.
I love
Okay.
it. We should have a t-shirt like that. So, this is stretched by doing this. We go like this with our face. Let's squint, come on.
All right.
Come on. Squint our eyes, squint our face, and squint our mouth like you're swallowing
This
a lemon.
doesn't do anything. You're just doing this to me to humiliate. Okay.
No. Everybody's joining us. Come on, you're one of many this morning.
Yeah. Okay.
Okay. Now try breathing now.
Well, you know, I've had a sinus infection. I've had pain here, and that you can feel it pull.
Right.
You can feel it stretch.
Now, if I had treated this here, I would have made a bigger change because my treatment is pressing the trigger point, which is not where the pain is, and then stretching the muscle, which has been released. But the stretching works well, but not as quickly. So it takes a little longer.
We don't have a whole lot of time left, but I want to get Bruce Pompiani in here.
Right.
Bruce, has you talked about the
treatment?
Bruce is a pain in the neck. No, Bruce.
By the way, Jen makes this face when she finds out she has to work with me. But that's another.
Bruce, you talked about the pressure that a lot of people feel here. He has what he calls knots.
I have a knot, and you could feel it back there. It's like a rock.
It's a whiner, but in this case, I think that there's some merit to what he's saying.
Well, this is like real estate. It's location. So you're telling me you hurt here?
Right.
Does it go down the shoulder blade a little bit?
A little bit. And
Okay.
Then
And
my
do you ever go
arm
down
as
your
well.
arm? Okay.
fact,
And
it's
does your
doing
hand
that.
ever tingle?
Sometimes. But
Okay.
usually it's the arm and the shoulder.
There's a book that we can just show it right here. You have a problem with a muscle called the scalenes. And people who remember their geometry well, there's a scalene triangle, and this muscle was named
There you
after that. This is the book, Myofascial Pain and Dysfunction. It's in every hospital in the world. And on chapter 20, this is my 4th copy of this book, chapter 20 is a muscle called scalenes. And here's my page, is being ripped out already, so we'll just take a shot of that, see? And here, if we zoom in, you'll see that Bruce's pain down his arm, in his shoulder blade, and in his hand is not coming from that area. It's being referred from where the X is. X is the hole in the roof, red is the leak in the ceiling. So we know his leaks, let's work on his holes. I'm going to also check now for range of motion. And range of motion is, we're going to see how
I
far...
have very little range of motion.
Well, I'm going to drop him sideways, because this is going to be the... So there.
Yeah, that's
All right.
motion a little bit.
Okay, now that's his bad side. Let's see how he compares to his good side. Something's wrong, because he drops much further this way than he drops this way. He's tighter. It's a difference of almost 20
Easy
degrees.
on the hair.
Okay.
Easy on the hair.
Can I stand up? Can I stand up now?
Go ahead.
I'm going to stand up. So, this muscle...
You know, often, if you get in a little panic here, these symptoms, you think you're having a heart attack some days. That's how much it hurts.
With it down your arm?
Well, with the shoulder and the arm, sure.
It imitates an angina pain. If you saw that pain that we had in the book there, it's very close to imitating angina, so you get scared. So this muscle here is called the scalene. There's 3 of them in here, and this is 1/3 of my practice.
Yeah,
Every 3rd person who comes in here has this, not because it's a common problem, because who is going to look for the back pain in the throat? Who's going to look for the arm pain in the throat? Who's going to look for the hand pain in the throat? And if it's bothering his chest, who's going to look for the chest pain in his throat? You got to have that little map, and you've got to be paying attention to Chapter 20, Volume 1, Myofascial Pain and Dysfunction by Travell and Simons. Now, I'm treating him. Now, watch what I did since I released that. See, his head dropped a little further. And then there's 3 of them in there. This is very quick work. I usually treat a patient for a whole hour at our pain center in Southside.
Now, when you press there, I can feel it in my shoulder.
So that's the proof that something here is feeding over there. And this has nothing to do with a nerve. This is a muscle that's gripping the brachial plexus. So here we go. And some people call this thoracic outlet syndrome. And watch his head now. See? That releases it. And then there's a 3rd muscle.
Okay.
And then we treat that.
And
look
this
where
is
I am.
where we kill him.
And look how far away from the shoulder this is. This is not acupressure we're doing. This is trigger point therapy It's working on specific trigger points, which are injury spots that Bruce got somewhere.
Can you feel that in your shoulder?
Yeah, yeah.
You know what? We're running out of time.
And
Thank
here we
you
go.
so much for
Here we
coming.
go.
Keep working on him.
You're running out of time. I have plenty of time.
Now, tell me what's happened.
It's remarkable. It really is.
You can feel
it's
it in your
it's
shoulder
so much
even though he's not touching.
all morning long. It has been like a rock, and just with that, it feels looser.
And I'm going to give him an exercise. We don't have time, but I'll give him an
no
exercise.
time for the
on
exercise.
camera.
Okay.
Sorry.
You have classes. You
Yeah, I
have
have classes,
you
right.
have everything right going on over on the south
On the
side.
south side, and we have classes at the YMCA downtown. We have classes at St. Stephen's Church in Swickley, and we have
Okay.
classes at down.
Tell us the name of the clinic too.
The
One
name of the
more
clinic,
time.
It's the Center for Pain Treatment.
Okay. We need to have you back and get some more
thank you.
time for you. We're
All right.
Works
fantastic.
very well.
Thank you very